Hi, everybody, and welcome to today's webinar where we're looking at enhancing outbreak response with Go.Data. As everyone continues to come in, we have a fun icebreaker question for you today. So as the holidays are coming up, we have our December, January holidays coming up. What's one destination on your bucket list that you've always wanted to visit during this season? And yeah, maybe tell us why. Feel free to put your responses on chat or come up with. Hi, everybody. Thank you for joining us in our today's webinar, which is Enhancing Outbreak Response with Go.Data. If you're just joining, we have a fun icebreaker question for you on the screen as we wait for everybody to come into the room. The question is, with the holidays coming up, what's one destination on your bucket list that you've always wanted to visit during this season? Obviously, for Sylvia, you say Bangkok. That's exciting. I've always wanted to go to France just to feel what it feels like for France in Christmas. Yeah, but anyone coming in, please feel free to put your response in chat as we wait for everybody else to join the webinar, and we'll begin 5 past the hour. Hello, everybody, and welcome to today's webinar, where we're looking at enhancing outbreak response with Go.Data. Thank you for joining. As everybody settles in, there's a fun icebreaker question for you on the screen. Feel free to share your responses on chat or come off mute. Just as the holidays are coming, we're asking, with the holidays coming, what's one destination on your bucket list that you've always wanted to visit during the visit? Feel free to come up here, put your answers in, let us know why. As we wait for everybody to settle in, we will begin the webinar in the next 2 minutes. Hello, everyone. For those of you who are just joining, welcome to today's webinar, which is Enhancing Outbreak Response with Go.Data. As everybody settles in for the next minute, we have a nice icebreaker question for you, where we're asking, with the holidays coming up, what's one of the destinations in your bucket list that you've always wanted to visit during this season? Feel free to drop your responses in chat. I see Bangkok, I see Botswana, Cook Islands. Okay, nice, Linda. And then feel free to put your answers on the chat as we wait for everyone to settle in and we can pick up our webinar. Okay, thank you everyone for joining our webinar today, where we'll have Go.Data showcase to us the application that enhances outbreak response. To begin, our webinar would want to just have a short poll question where we'd want to know, how would you rate your overall knowledge of global goods? So not much, I know quite a bit, I know all about global goods. Can you respond on the poll that pops up on the screen? Okay, I see the responses coming on chat, not much, I know quite a bit. Yeah, I think the poll has come on screen. Just kindly select your answer on screen so we can have a feel of the audience we have today. Just for a few more seconds, we're having a quick poll question. How would you rate your overall knowledge of global goods? Not much, I know quite a bit. I know all about global goods. Okay, thank you all for your responses. Just waiting for the poll result. Okay, for the poll results, we have 50% saying not much, 51% saying quite a bit, and 19% saying I know everything about global goods. It would be great to move those lines to the next line. Not much, but quite a bit, trying to move everything. And hope to be closer to achieving that today. Thank you all for your responses on that. So for today's agenda, we'll first have just a brief introduction on global goods, and then hand over to Go.Data, who'll give us a presentation on the application and have some time for Q&A. So just to begin with an introduction to global goods. So global goods are impactful, open source solutions designed to improve health outcomes on a global scale. Some of the characteristics of global goods is that first, they're open license, which means they're open source and free to use, adapt, and share. They're health focused, which means they're specifically designed with health systems in mind, aiming mostly to improve public health delivery and outcomes in low resource settings. They have a strong community with clear governance, where we find that every global good is backed up by a robust community of contributors. This ensures continuous improvement and sustainability. They have multiple sources of funding from various donors and organizations, which ensures a broad base of support for their development and maintenance. They're also scalable. They're designed to be flexible. The tools can be easily adapted and scaled to different country contexts and health systems. And lastly, there's proven use and effectiveness. We have many global goods demonstrate success in real-world implementations, which shows off their value in improving health outcomes globally. So today we're excited to announce that we've recently added 3 new global goods to our collection of global goods. You can explore this along with others in the Global Goods Guidebook. We'll share the link for chats. Today, we'll be showcasing one of these new additions, which is Go.Data. We'll dive into how it works, its impact, and why it's a valuable tool for health systems work. So to introduce our esteemed presenters for the day, we have Sylvia Edith, who is an epidemiologist, GOARN operational support team, which is part of that, and in the Department of Alert and Response Coordination, ERC, at WHO. Thank you for joining us, Sylvia. We also have our other speaker, who is Sarah Hollis, who is a team lead in health information and risk assessment, and is also in the Kenya Regional Emergency Hub, working with WHO. Thank you both for joining us, and I will hand over to you, Sylvia, to present on Go.Data. Thank you.
Many thanks, Luciana, for the introduction. Sorry, I was having problems to unmute myself. So as she mentioned, my name is Silvia Morreale, and I'm part of the GORN operational support team. My colleague, Sarah Hollis, that she was going to present today with me, unfortunately, she was deployed in response to the Mpox emergency, so she will not be able to present, but I will walk you through the Go.Data project and present you which are the key features of these applications. So many thanks again. I'm going to start by sharing my screen. Can you confirm that you see my screen in presentation mode?
Yes, we can see.
Many thanks. So again, many thanks for the invitation to participate in this Digital Square webinar. It is an honor for us to be able to share with you the Go.Data project. So during this presentation, we are going to cover two different aspects. First, the idea is to provide an overview on this tool, and then to do a quick demonstration on it so that you can better understand what this application offers in order to provide support for outbreak investigation and contact tracing activities. So for those of you who are new to this project, Go.Data is an open source tool that was developed by the World Health Organization in collaboration with partners at the Global Outbreak Alert and Response Network. This application was designed based on years of field experience and was designed especially for use for field-based users such as epidemiologists, contact tracers, and lab personnel to manage case and contact data, and in particular, to offer them with timely and structured data collection, management, and analysis, and also with specific features to facilitate the contact tracing activities. Notably, Go.Data generates a series of outputs and analysis such as contact follow-ups and visualization of chains of transmission. You can see here on the right. The application is also highly configurable and easy to adapt for a wide range of outbreak scenarios and contexts. So moving to some key facts, the Go.Data project team has supported large-scale implementation during the COVID-19 pandemic, where Go.Data was used in over 65 countries and territories, and in over 150 institutions at different national levels. Go.Data is formed by a diverse and global community of practice, which works as a one-stop instance for all documents and materials. We have a dedicated team, which is formed by WHO personnel at HQ, and with focal points at the US CDC, ECDC, and also focal points in the 6 WHO regional office. The reach of the project is, and its implementation is global. Moving to the application's key features, we can highlight that this application operates in different platforms, such as Windows, Linux, Mac, iOS, and Android, and works both online and offline. It offers the possibility to add and modify the software languages, and is highly configurable, which the option to set up a specific and granular location and data variables. It also offers different features for the easy creation of data collection forms and questionnaires, and is flexible enough to allow for different users' roles and permissions. One Go.Data installation can be used to collect data for many outbreaks, and the focus of this application is on cases, contacts, and its related data. And for related data, we are referring to lab information, hospitalization, events, clusters, and so on. It also offers extensive data import and export features, and it generates cases and contact follow-up lists, and also contains an optional mobile application, which is focused on contact tracing. As we were mentioning, this application offers different features to visualize the chains of transmission. On the left-hand side, we can see an example of a chains of transmission graph, and on the right-hand side, a chains of transmission bar that will allow us to follow all the different events that happen to a case and its contacts. Here we can see on the screen another example of the chains of transmission. Here, as you can see, the icons have been replaced, but have been modified in order to represent the gender. But we can use any icon that we think that would be useful to better understand the outbreak dynamics and specific characteristics. Here we have an example of the dashboard that can be used to monitor the cases and contacts follow-ups activities. Go.Data offers a dashboard which has some descriptive analytics, and we will see this in a minute, on cases, contacts, and chains of transmission. But in some cases, our community of practice has highlighted the need to have more advanced analytics. So, and here I would like to make a parenthesis to thank our big community of practice, because some of the things that I'm going to present now were developed by the different implementers in countries and institutions. So what was developed is a series of add-ons, templates in different softwares such as Power BI, R, Python, QGIS, Google Data Studio, which can be easily connected to Go.Data through its APIs in order to have more advanced analytics. Here I'm going to show some examples of the dashboard that can be created by connecting Go.Data, in this example, to Power BI. Here we have other examples. On the left-hand side, we have some dashboards that were created in RStudio and RShiny Apps, sorry. And on the right-hand side, a dashboard that was done using Google Data Studio. And here is another examples on Power BI. All of this that I'm showing is available in our GitHub, and any implementing country, institution, or user can download these templates connected to Go.Data and have this advanced analysis. With regards to the areas of the impact, I can mention that during the period of 2022 and 2024, Go.Data was integrated into national and institutional systems and was included in training programs. During this period, there were several publications that were done, which analyzed the application use in different contexts. For example, we have a publication that was done in Lancet, where Argentina, Guatemala, Chile, and Guatemala, Argentina, and the University of Texas shared their experience in the use of the application during a COVID outbreak. Additionally, we also have a mixed method study on the implementation of Go.Data during COVID. This study was conducted in 28 countries across all WHO regions. And there's other publication also that were done by Ministry of Health. There was a recent publication made by Chile on the use of this application in the context of Mpox outbreak, and other publication made by the Ministry of Health in Uganda with regards of the use of the application during an Ebola outbreak. So throughout all these studies, what we found is a common theme, or we have observed in general that these implementations led to improved timeliness and completeness of the outbreak investigation data, improved data quality, so the data was more clean and structured, centralized. All the data was also centralized in one system and not in different applications or softwares. There was also observed in some cases an improvement in the access to case, contact, and its related data. And here I would like to highlight one of the key features of Go.Data, and it is that this software has a relational database. This means that all the information that we register within the application is interconnected, and we will see this in a moment during the demo. But basically, when we register a case and then the contacts that are associated to it or events, all of that is related to within the application. So when we want or we need to understand the outbreak dynamic, when we access the application, we can see all these connections. We can help us to understand or have a better understanding of the outbreak dynamics and specific characteristics. It has been also observed an improvement in data visualization, analysis, and reportings, in particular of the chains of transmissions, and faster and easier facilitation of all the activities related to contact tracing. So for those of you that would like to learn more about this application, we will share after this webinar, this presentation, where you can access throughout these links to our community of practice, the website where you can access also any news events that we have and download the files, and the GitHub where we have all our technical documentation. We will also share the link to our annual report, an interoperability consultation report that we have, and 2 examples of 2 countries that have implemented this application. So this is all with regards to the first part of this presentation, which covers an overview of this application. I will move now to the second part, where we will have an overview or a quick demonstration on the features that this application offers in order to facilitate the outbreak investigation process. So as you can see, I need as any other application, my user account and password in order to access to the application. The third thing that we see is the dashboard, which is collapsed per default, but we can expand it by clicking on Expand All. And by doing so, we will have access to a series of descriptive analytics on the outbreak under investigation. So we can see the cases summarized by different categories. We can also see the change, an histogram on the change of transmissions. And there's one report that is really useful and has been highlighted by different teams, which is this one, in which contact tracers and epidemiologists can see the progress on the contact tracing activities and have a better understanding or monitor if the teams are being able to follow all the contacts that on a specific date. On the bottom of this dashboard, we also have KPIs for cases, contacts, and chains of transmission. All the things that we see here in this dashboard are interactive in nature, so we can easily click on any of the options that we want in order to include a category, exclude a category, or also if we don't select one of these subcategories, we can directly see the cases or contacts that are included within that specific category. So going back to our landing page, we see that on the left-hand side, we have a menu, which is divided in two sections. On the upper part, we have all the different sections that are related to the data that we record within the application. And on the bottom, we have the system administration features. One thing to highlight is like all the sections that I see in the application will depend on my user permissions and roles. So a user that maybe is only in charge of contact tracing activities will not be able to see all the sections and perform all the different actions that are available within this application. One of the things that has been highlighted by different teams, and we can say that is a key advantage of this application, is that most of the configurations that can be done within the application do not require any coding skills. So any user with the proper, of course, roles and permissions will be able to configure or further customize the application to the countries or institution-specific needs. So for instance, in the reference data, we will have access to the core set of variables that we can find within the application. And here we can further modify the values of these variables by excluding some, updating them, or eliminating them. And also we can include icons that then the users can use to visualize the chains of transmission. It is also possible to set the locations. We can set as many locations as we want. And we can do it in a manner that actually represent the administrative areas of the places or the context where the application is going to be used. In the admin section, users will be able to manage users, roles, the language that are used within the software. So as you can see here, by simply exporting an Excel and importing it back, we can add new language to the softwares. For contact tracing epidemiologists, it's important to say that they can also administrate and manage the teams that will be working. And in the system features, they will be able to integrate Go.Data with other systems and also to manage automatic backups, which is important to maintain the data integrity and consistency. But going back to the first part of the upper part of our menu, where we find all the information related to the data and the outbreaks and the investigation, we can see that this section is formed by two parts, outbreaks and templates. And these templates are really useful because they offer what we call WHO standardized templates, which will allow us to create an outbreak within minutes. For instance, if we have a measles outbreak, we can just simply click here on the plus icon and generate an outbreak. This template contains standardized investigation forms, standardized coding, which will facilitate the data analysis, and present target indicators. And by clicking here, the only thing that happens is that this template will be moved from this section to this section, outbreaks, where we actually have the outbreaks under investigation. It can happen that the disease under investigation is not contemplated in one of our templates, and if that's the case, we can simply add a new outbreak, and by doing so, we can create a new outbreak and start an investigation. So I'm going to click on this demo outbreak that we have here to show you how we can easily set up and how flexible the tool is in order to set up an outbreak. So as you can see in the first tab, we have the details where we can indicate, of course, the name of the outbreak, but also we can say how we want the case ID, event ID, and contact ID to be set it up. We can also say if we want to apply geographical restrictions so that users will only have access to cases or contacts that lives in a specific area. We can also indicate if we want to allow lab sample collection for contacts, and along with other features that we have here for further customized the outbreak. We can also indicate how the contact and cases follow-up will be done and the report that the application will automatically create. So here we can say the threshold that we want for these different indicators. In addition to this, as you can see, we have 8 tabs in total, where we can also indicate other aspects or configure other aspects of these outbreaks. One of them is the map servers. Here we can say which is the maps that we want to use to display the collected data. So here you can use any base map that you have. Per default, you have the WHO ones, but this can be updated. In the field section, users can say, okay, from these, I don't know, I'm going to say any number, 34 Go.Data variables, I do not want to use the middle name because it's not relevant, so I unclick it. Or I can also can say, I want gender to be mandatory. So basically what we can do here is to say, I want this variable to be part of my outbreak, and I want this variable to be mandatory or not be mandatory. In addition to that, for some specific variables, you can also select the values that you want to include for this outbreak. And for all healthcare workers, is obvious that same categories do not apply to all diseases. So maybe they need to select some of these options that are more relevant for a disease, but maybe are not relevant for another. So here they can customize the values that will be displayed when we complete the case of contact data. In addition to that, as you can see, we have a series of forms for cases, contacts, events, case follow-ups, contact follow-ups, and lab forms. In these forms, what we have is a questionnaire builder, and this works as any other questionnaire builder that you have used in the past. So basically here, if you see that the core data set that you are using, Go.Data offers, do not include all the variables of questions that you want to ask for cases and contacts, you can simply click on Add and include the question or variables that you want to have for any of these different entities that you see here on the screen. Once you have made all your changes, you click on Save, and you are ready to start registering cases and contacts. So let's imagine that we have our outbreak already set, and we're going to start our case investigation and contacts listing and contact tracing activities. So in the case section, you will have the list of cases. Here we have, of course, dummy data. Nothing that you see here is real. All of this was created, is dummy data that was created for demonstration purposes only. So here, what we have is the list of cases, that were registered within the application. And again, this line list works as any other spreadsheet that you have used in the past. So if you drag and drop, you can change the position of the columns. You can also select a subset of cases of contacts by applying filters. You can also use advanced filters in which you combine different categories. You can also select the columns, the variables that will be displayed. And by clicking here, you can also access to a summary on the cases classification. In addition to that, the application through the quick options button offers a series of features that will allow you to monitor the quality of the data and also to export and import data. So for instance, you need to create a new case. You can simply click on the button add and add the new case, or you can also bulk add cases by importing a file. So for instance, let me click here on add. As you can see, to add a case, I need only to simply complete all the different tabs, and then we will have our new case created within the platform. But let's explore how this case record is formed. I'm going to click on the icon that will allow us to see this record. And if you see here for this case, we have personal information, we have epidemiological information, the questionnaires that are the variables that we have added for this outbreak. Then we can see the contacts, and here's where we start to see how Go.Data relates all the different information that we register, the data that we register within the application, and display this information to us. So when I enter this case, I can see all the contacts that are related to this case. And also by scrolling here to the right, I can see the characteristics of these different exposures. If I need to modify something, I click on the pencil icon and I can update this information, of course. Then by clicking on exposures, we can see this case was also exposed to another case. I forgot one thing that is quite useful. If you see here on the status, we can see if any of the contacts has transformed from being a contact to a case. So we also have this information. And of course, by clicking on any of these names, we will access directly to the folder of these specific contacts. Then we can see the lab results that we have for this specific person and the follow-ups and the status. So we can see if the third person had symptoms or not. On the top, you are looking here that the application is preventing me of creating new duplicates and saying, hey, you already have a person that has the same name. And why? Because this is the metadata. So all the cases and contacts have this name 1, name 10, and that's why it's saying that. But this is just to show that if someone create a duplicate record, even when it is completing all the data, the platform will alert this person about the situation, and the healthcare worker can decide if he wants to proceed or not with the creation of the case. Or, of course, this can be merged. In the quick actions, we can also access more information on this case, and from all these options, I want to show you the view movement. You can see this for any single case and contacts. You will see all the places where this person was. And as you know, this is really useful in case this case in particular, was traveling while infectious, because we may expect to have secondary cases and contacts in these two locations. So seeing this in a map can also support us to guide our investigation efforts. So once we have our cases, of course, we can start registering contacts. And this is really simple. We just click here, we add a contact manually, one after the other, or we can also click on bulk add contacts. And if we do that, Go.Data will display a spreadsheet where we can add all the information on these contacts. And for all of you that have done case investigation and contact tracing activities, may know when we do the case investigation process, usually cases mention many contacts at the same time. So this is really useful because you can start completing all the information on the different contacts and then save. All the contacts are saved in the contact list, and as you can see, we have the same displayed as for cases, with the only difference that here we can see the contacts classified per the risk level. And then if we access any of them, we will have the same information that we had for cases. And another feature that is also useful and is available both for cases and contacts is the chronology. Here you can see all the events that happened to this specific person since it was recorded in the application. So again, this also helps us to track all the events that happened to a specific person. Once we have registered all our cases and contacts, most probably we would like to do the follow-ups. The follow-ups can be done for cases and contacts or only for contacts, and this can be set at the Outbreak level. In the daily follow-up section, what we will have is the list of follow-up that we will have to do on a specific day. So if you see here, the follow-ups that we have for today. But of course, we can increase the time and see more follow-ups. In this section, we can also see a summary of the teams and the contacts or cases that were assigned for follow-up. This can be really useful if you are a contact tracer coordinator, as this will allow you to see if the distribution of people per teams is even, or if we need to revise the distribution. Here to perform a follow-up, you can simply click on modify, or if you click on this button, you can see all the follow-ups that were performed for that specific person. I will not get into detail into this section, but I'm going to move to the follow-up dashboard. Here you can have an overview of the cases and contract follow-ups. And let me add this variable, person type. And why I'm adding this? Because here we can see on the dashboard for cases, and we can see how if the person had symptoms, no symptoms, and we can also see both cases and contacts or only contacts. As you can see here, we can have this dashboard provide us with an overview of the status of the cases and contacts, which can be really useful in terms of having an overview of how this work is being done. For instance, if we have a lot of gray color, which means not perform, we may think that maybe we have a high number of contacts and our teams are not able to cope with a high number of contacts, so we need to increase the people working on this. On the same time, if we see contacts that are starting to have symptoms but remain as contact, we can indicate if the appropriate measures were put in place. For instance, if the person had a lab test, if we need to convert this person to a case, or which activities or measures we need to implement. By clicking on any of these boxes, we will have access to the follow-up questionnaire and details for that specific day. And as you see, we can change the status and complete the questionnaire if there is any. Once we complete all the information, we click on save. Let's change this. And then we can continue doing our work. So if you see, I have changed this follow-up for that specific day. So moving now to the visualization section, I would like to show you the options that we have within the application to visualize all the data that we have registered. I'm going to click on the most recent chains of transmission that I have created here. As you can see, it doesn't look very nice, but this was done on purpose. So when we have like a lot of cases and contacts, this information is loaded really fast. And then we click on precise rendering and everything will look organized. So as you see here, we can see the different chains of transmission that we have within the application. In purple, we have the events. And if we zoom in, we can see what type of event was. And by clicking on any of these features, we can access additional information on that event. It was a birthday, when it happened. And of course, if we click here, we can access all the information on this event, including the contacts that are attended and the exposures, if any. So going back here. Just to mention, the change of transmission, similarly to the dashboard, is interactive. So you can change absolutely everything, move the bubbles, change the color of the bubbles. If you click on the edit mode, you can also edit the data that you have on the change of transmission. But in terms of have a better understanding of the outbreak dynamics and specific characteristics, here you can use different chain options. You can see them in a map, so you can see the connection between cases, contacts, and events. You can also see this data represented in a timeline and the connection between the different entities that you have here registered within the application. And also, you can further customize the chains of transmission. Here, you can change the label. For instance, you can say I want the initial and the location. You can change the label color, the icon. For instance, if you think that the occupation is relevant to have a better understanding of this disease, you can include here the icon. On the age, you can also, for instance, select to context of transmission and snapshot, and we're going to go back to the network. The bubble. So if you see here, we are going to see again our chain of transmission, but now we will see the different occupations that the cases or contact has. So here, if you see, we have students, we have people that's working in the, are farmers and healthcare workers. So by looking at these can also help us to identify if we have any cluster. As you can see, we can reaccommodate all the bubbles in order to have a better visualization of the chains of transmission. In addition to this, we have the chains of transmission bar, where we can see for each one of these cases, all the different events that happened, if it was hospitalized, when, the date, if it had a lab result, if it was positive, negative, if the person died, and if relevant, if the burial was safe or not. We can also access the chain of transmission list, where you have a summary statistics of each chain of transmission. You see the root case, number of entities, cases, the cases that are alive, the events, and if they are active or not. Then finally, in the case count map, you can see the cases organized. Here's only cases in different places and where they are located. So this was a really quick overview of the different features that the application offers in order to set out an outbreak and conduct the case investigation and contact tracing activities, and how it integrates all the information that we have recorded within the application, and also how we can visualize the chains of transmission to have a better understanding on the outbreak dynamics and specific characteristics. This will be all from my end, and I'm open to questions in case you have any. Many thanks. And over to you, Luciana.
Thank you. Thank you so much for that, Sylvia. That was such a that was an insightful presentation. The interface looks very intuitive and quite impressive and user-friendly for such complex tasks. So I'll open the floor for any questions. I think, Giuseppe, did I see your hand up? If there are any questions, you can put them on chat, or you can just come off mute.
Hi, question. This is very helpful, and I think that you know, as someone said, it's very intuitive to set things up, and it's great that it's very configurable, and that doesn't require code or programming effort, which is fantastic. My question was more around interoperability. Is it able to connect to, for example, facility registries, client registers, health worker registries, in order to sort of fetch data from those systems in settings where you have an HIE, for example, so that you have a single source of truth. So I was wondering about that aspect of it. If you can share something there, thank you.
Many thanks for your comment and really important question. This is really important, and because Go.Data, as you know, is an outbreak response tool. So it's not a tool that you will use on a regular basis. It will be used when there is an outbreak. So as you said, it's really important to interoperate this application with if there is a national surveillance system or any other registry that is used within the country. So to facilitate that, Go.Data has the APIs that are exposed and are easily retrievable for it to build any middleware to interoperate the application with other tools. And most of the countries that we have supported have integrated this application with the national surveillance system. We have also worked with the HIPS Uganda team that has developed the name is Data Resolved that connects Go.Data with HS2. So this application already exists and is available for use. We also have, and I can share in the chat, our interoperability report, because we held a consultation 2 years ago where many countries had presented the interoperability solutions that they have developed to interoperate Go.Data with different systems. We also have countries that have interoperated Go.Data not only with the national surveillance system, but also with the vaccine registry, lab registry, civil data registry. And by interoperating these and connecting all the information, they had really impressive results because they were able to be in advance of outbreaks because they identified a case in a specific school. So they also integrated with the school data. So they went to schools and implement all the preventive measures and were able to prevent the creation of clusters. So the short answer is going to be yes, it's possible, and we have a lot of the documentation with regards to how to interoperate Go.Data with other systems, and there is also apps that have been developed and are available in our GitHub. So many thanks for this question.
Thanks very much.
Thank you, Sylvia. The other questions on chat, I'll just pick the first one, which is from Dipanjali, who's an MPH epidemiology student. And his question is, can Go.Data be used for class projects, or do we need any approval? I'm sorry, Sylvia, you're mute.
Yeah, I'm sorry. I didn't realize that I was muted. So I was mentioning that, yes, Go.Data is an open source tool. So there's no permission. You don't need to ask for permissions or get any approvals to use the application. And it can be used for different purposes. We have universities that have downloaded the application and use the tool also to conduct studies, investigations. So I'm going to share the link in the chat where you will see one of the first links is to download the application. So the application can be easily downloaded and anyone can use it. We also have courses that work students on the different steps to set up this application. The courses go on how I start from zero, how I configure the application, how I do case investigation, contact tracing. So we have guidance and documentation so that teams are not alone or users when they want to install the application and also use it. We can also share, if people is interested, the links to the courses that we have on how to install, how to configure, and how to use the application.
Thanks for that. So we have the two other questions from Anna and Janina. So Anna is asking if it's possible to be used for chronic diseases like leprosy. And the second question from Janina, which I guess you've answered, is how can Go.Data be accessed?
So in the case of the first question, it's important to highlight that Go.Data was developed and was created as an outbreak response tool, a tool to support the outbreak response activities and to facilitate them. In this sense, it was designed specifically for transmissible diseases. Despite saying that, I have to say that we have a lot of countries that are implementing the tool And they are also using it for chronic diseases. Even though the application was not designed for these purposes, we know that our countries, we have a number of countries that are using this application, and specifically for leprosy. There's 2 or 3 countries that are using this application for this disease. And if I'm not mistaken, based on this request, we have a template that is available in the application for leptospirosis. So there's already a preset template, WHO template, for so that teams can use it for leprosy. And the second question with regards to how to be accessed to China is the link only by downloading the application. So the link that I pasted in the chat. No approval, no representative, anyone can use the application.
Okay, and we have another question from Roger, which thanks you for your excellent presentation, and asks what are the technical requirements for hosting the data? And in your experience, what would be the typical time for parameterization of a new pandemic? And lastly, in line with Ali's question, is the API aligned to prior standards for other standard things?
Many thanks for all these questions. This is also a really good question, like all the other ones. So with regards to the requirements, I can share with you the community of practice. We have the requirements to install the application, but they're really basic. It's not like fast. We need to understand how are you going to use the application? So for instance, if you're going to use it on a standalone installation within your computer and you're going to have just a few numbers of data points, a standalone installation on a PC is enough. If the application is going to be used at an institutional level or at the country level, maybe in those cases, we need to move to a server installation or a cloud installation, so the requirements might change. Depending on the use that is going to be done to the application. We have a document that is in our GitHub, and I can, in our community of practice, so I can share this too, where we have this description with simple questions. So, and it also said how easy or difficult it is to install. But basically, the requirements are quite basic. It's not that you need something really complex in order to run the application, but it will change depending on how the application will be used. And let me share this in the chat for you. So here you will see this is our community of practice. And if you scroll down, let me share the screen. So wait, I cannot share the screen, but if you scroll down in that page, you will see a guide that's called Installation Specification Guide. And there you will find all this information. You can download this from the page. This is the name, and here you have it. And then that's the document that will help you to better understand the requirement. But I said they are quite basic. It's not something really complex, but it will depend on the use that will be done of the application. So typical time, again, depends the use, but let's do a fake scenario. I want to use it for outbreak investigation. And let's say at an institutional or country level. I would say that what takes more time is the approvals at the country level in order to implement the tool. Because when you start an application, you always need to know which is the national digital health strategy. You need to comply with them and any regulations within the country. So that might take more time, but if we remove that from the analysis, we can say that in 2 to 3 days should be set up, maybe less, because to do the setting up of the location, you only need the Excel with the information, important. To set up an outbreak, you need the questionnaires, you create them. It's just 2 to 3 hours, depending on the complexity. So I would say like in 3 days, maximum 1 week. I mean, if we need approvals, if we need to get the data, and we don't have it, the information to set up the configuration, 1 week. But if you have everything, 2 to 3 days should be more than enough, like more than enough. And then in line with the APIs, we are working now, just to say, the APIs are not aligned with FHAR standards, but we are building a mapping so that you can make the application talk with other applications. So we are working also with the Data2 team, eWords team, and on a mapping to the different applications, to the logic of, a mapping that will analyze the logic of each tool and these different standards. But the short answer is no. Yes, it's true. It's a leprosy disease. I'm so sorry, Anna. You're right. I made a mistake. Yes, you're right. It's a transmissible disease. Sorry, I made a mistake when I said that. And then, yes, the application can be used offline. And here will depend on how it is installed. If it is installed on a computer and it's a standalone installation, yes, can be used online. But if it is installed on a server, on a cloud, of course, you may need to use it with access to internet. But the application works both online and offline. Luciana, I answered all the questions. If I forgot anything, please, anyone can let me know.
I believe you answered all the questions. Thank you again for that very insightful presentation and answering those questions. For the audience, we'll be sure to share this out with you in a later date and share the presentation and the recording with you. So coming up next week, we have another webinar, which will be by Observational Health Data Sciences and Informatics on the OMOP CDM tool, which is the observational health, which standardizes diverse health data like electronic health records and insurance claims for research and reporting. So look out for that webinar communication. Otherwise, thank you all for coming and see you next time. Have a great day.
Many thanks, and many thanks again, Luciana,
Thank
for the
you.
invitation.